change for once in my life. It's gonna feel real good. Gonna make a difference. Gonna make it right. Starting with the man in the mirror, I'm asking him to change his ways.
As we all know, having adequate hand function to perform everyday tasks is imperative to being involved in the world around us. We use our hands in almost every action we perform, and losing hand functions limits our ability to perform everyday tasks. People who have had a stroke may have trouble carrying out everyday tasks that we take for granted. How can we, as occupational therapists, help people who have had CVAs to recover their hand function? Using MirrorTherapy is one successful method I've used in practice to help clients regain hand function following their stroke. This is a mirror box. It's quite a simple concept, just a sturdy box with a mirror attached to the side. During a MirrorTherapy session, the client will sit opposite the therapist and perform actions with both of their hands on the table. The client's affected hand performs the action inside the box, while the unaffected hand performs the same action outside of the box. The client should try to keep concentrating on the reflection of the unaffected hand throughout the therapy session. We'll delve deeper into the theory of how MirrorTherapy works later in this film. First, let's take a quick look at some examples of the types of exercises your clients can do during MirrorTherapy.
The MirrorTherapy program that you set for your client will obviously depend on the client's level of function. Studies into MirrorTherapy have found that it is beneficial for even the earliest stages of stroke rehab. You could start the client's program by doing simple range of motion exercises as you see here in the film. Even if their affected hand inside the box is not capable of the movement, seeing the reflection of the unaffected hand performing the movement successfully will be beneficial for their rehab. Objects can easily be used during MirrorTherapy. Here you will see everyday objects being used to build muscle tone, practice different grasp and grip actions, promote fine motor movement, and practice in-hand manipulation. These activities can easily be graded by the therapist. For example, you could change the amount of times the activity is to be repeated in the program. Or you could change the size of the objects, for example, from large marbles to small marbles. Activities can be timed by the therapist to provide a measurable baseline that goals can be set against. For example, pick up a total of 7 marbles, one at a time, within 20 seconds. I have found that setting these timed goals with patients gave them incentive to practice their MirrorTherapy program between therapy sessions. Practice is very important in order for MirrorTherapy to be successful, and it's one of the key things to remember when designing MirrorTherapy programs with clients. Clients will need to go through practicing their MirrorTherapy routine at least twice daily for 30 minutes at a time. Other key principles to remember is that the client should concentrate on the reflection of their unaffected hand, the mirror should be clean and without imperfections, and that the mirror should be placed at a 90-degree angle at the client's midline.
Some of you might be wondering, how does MirrorTherapy actually work? The practice of using a mirror box for hand rehab with strokes has come about quite recently, so the neurophysiology behind it is still being researched. Leaders in the field have proposed that MirrorTherapy activates what are called mirror neurons. The presence of mirror neurons were discovered by physiologists during their work with monkeys in the 1990s. These neurophysiologists discovered that mirror neurons would fire when the monkeys reached for a peanut, as well as when they observed the neurophysiologists reaching for a peanut. From these studies with monkeys, it is deduced that mirror neurons are activated during both actual physical movement as well as during the observation of movement. Neurophysiologists state that mirror neurons are located in the frontal lobe and the parietal lobe of the human brain, and they're a division of motor command neurons in those areas. It is thought that for stroke patients, mirror therapy works to activate mirror neurons that have survived the stroke but might be laying dormant, or their activity has been inhibited, or the feedback loop between them and the corresponding motor neurons has been interrupted by the stroke. During mirror therapy, the visual feedback that is provided by the reflection of the unaffected hand reactivates these mirror neurons, which then provide visual input to the corresponding motor neurons, reviving them and resulting in increased motor movement. Now that we all understand how mirror therapy works, let's establish evidence of its success in the field of stroke rehab. A systematic review was carried out in 2009 of mirror therapy literature. Its conclusion was that mirror therapy is effective in upper limb rehab for stroke patients. Importantly, another study I found that wasn't included in the systematic review concluded that conducting mirror therapy early in stroke rehab is a promising method to improve sensory and attentional deficits and to support motor recovery in the distal plegic limb. From a personal perspective, I think mirror therapy is a relatively easy and effective way to provide upper limb therapy for patients who've had strokes. It was certainly successful for the patients I worked with on my placement, and I'll certainly be integrating it into my practice as an occupational therapist.